My name is Morgan Farrell, and this is my presentation on narcolepsy. Narcolepsy is defined as a chronic neurological disorder that affects the brain's ability to control sleep-wake cycles and greatly affects the daily activities of people. This shows a baby sleeping soundly. Affected individuals feel rested after waking, but very sleepy throughout much of the day. They also experience uneven or interrupted sleep that frequently involve waking up during the night. As mentioned earlier, this disorder has great effect on daily activities. Those affected may unwillingly fall asleep even if in the middle of an activity such as driving, eating, or talking. These effects may also include sudden muscle weakness while awake, causing the person to go limp or unable to move, a condition known as cataplexy. Some other effects on daily activities include vivid dreamlike images or hallucinations, and total paralysis just before falling asleep or just after waking up, a condition known as sleep paralysis. This image shows an example of a woman with her child. The woman, as you can see, is totally asleep, which shows an example of the condition of narcolepsy. Narcolepsy affects both males and females equally, and it is estimated that anywhere from 135,000 to 200,000 people have it in the U.S. However, it often goes misdiagnosed because it gets confused with psychiatric disorders or emotional problems, leading it to take years to get the proper diagnosis. There are two major types of narcolepsy, type 1 and type 2. The first is based on the individual either having low levels of hypopretin, a brain hormone, or reporting cataplexy and having excessive daytime sleepiness. The second has people experiencing excessive daytime sleepiness but usually don't have muscle weakness triggered by emotions and normal levels of the brain hormone hypopretin. So, to sum it up, the typical symptoms of this disorder are excessive daytime sleepiness, or EDS, cataplexy, sleep paralysis, and hallucinations. Additional symptoms include fragmented sleep and insomnia, as well as automatic behaviors. So to explain why these symptoms occur, you need to go deeper into the concept of how sleep works. In a normal sleep cycle, a person enters REM, or rapid eye movement sleep, after about 60 to 90 minutes. During this time, dreams occur and the brain keeps the muscles limp to prevent people from acting them out. However, those affected with narcolepsy enter REM sleep more rapidly within about 15 minutes. During these 15 minutes, there is muscle weakness and the dream activity of REM sleep can occur during wakefulness or be absent during sleep. So what actually causes narcolepsy? Although it's not fully understood, current research suggests it may be the result of a combination of factors working together to cause a lack of hypopretin. These factors include autoimmune disorders, family history, and brain injuries. There are some treatments that can treat some of the symptoms of narcolepsy. These treatments are mostly medications and lifestyle changes. These medications include modafinil, which is a central nervous system stimulant, and amphetamine-like stimulants, an example of which is methylphenidate. Two other medications include antidepressants, examples of which are tricyclics, selective serotonin, and non-adrenergic reuptake inhibitors, and sodium oxybate, which is a strong sedative that should be taken twice at night. The lifestyle changes include taking short naps, maintaining a regular sleep schedule, avoiding caffeine and alcohol before bed, avoiding smoking, exercising daily, avoiding large, heavy meals right before bedtime, and relaxing before bed. The following link is a YouTube link to a video showing a person who has this disorder. I just want to warn you that it is a little bit disturbing to watch, so your discussion is advised. Lastly, here is the main reference that I used. Thank you for listening to my presentation on narcolepsy.